Good morning, Seneca County residents. Once again, it is Wednesday, and I'm glad to be back with you. As always, I give an update of what our status is here in Seneca County as far as our cases. We do have 14 cases, which include the one that is deceased. We've got 7 men and 7 women, so it's equal there. 1 hospitalized and 8 have recovered. So, wish we hadn't had the last few. We were moving along at the same pace for quite a while, and but we knew that this would happen, of course, and we still anticipate probably there will be more. Hopefully not too many. I think the big topic of discussion this week is the announcement that Governor DeWine and Lieutenant Governor John Husted, as well as Dr. Amy Acton, made on Monday. And they made the announcements considering what they're calling Responsible Restart Ohio, with the plan to reopen businesses gradually. And they used the guiding principles of protecting the health of employees and customers and their families, and trying to prevent that spread of COVID-19 by responsibly starting to open things up and getting Ohio residents back to work. As of May 1st, if you did not hear I'm sure you probably heard it or have read something about it, but just to refresh memories on what's happening, May 1st, opening all procedures that are done at the hospital if you do not have a stay overnight. So some of those elective processes, tests, those types of things are being restarted on May 1st. And dentists, veterinarians were given the go-ahead to open their offices as well. Then the next wave begins on May 4th, that's next Monday, and manufacturing, distribution, and construction businesses may reopen if they were not in fact open as an essential business prior to this. And that, of course, is always the mandate that there be safety practices conducted, and we'll talk about what those safety practices are. But those are going to be required both for the employer and the employee. And then on May 4th, general office environments can reopen if they had been closed, and again meeting those safety requirements. And then May 12th, consumer retail services may open if they can meet those requirements. And if you are interested in seeing each of these different guidelines, you can go online at coronavirus.ohio.gov, which is the website you've gone to for information about coronavirus for quite a while now, but then it's /Responsible Restart Ohio, and then it gives the guidelines for each one of these segments as far as reopening and what is expected. Protocols for all businesses are they're recommending face coverings, and as you may know, on Monday when the governor spoke, he said that they were going to be mandatory. He did change that to suggested, as there were some concerns presented by some people regarding the fact that face coverings may not work well for some people. I would have preferred, I'll be honest, I would have preferred mandatory, because I think this is one of the ways that we can most effectively stop the spread of coronavirus, this COVID-19. And if you've listened to those press conferences at all, you've heard Dr. Amy Acton talk about Swiss cheese, and when you have a slice, you usually have a hole in it. But if you're layering those slices to make a sandwich, each subsequent slice is going to cover a hole. So therefore, when you get several slices together, hopefully there won't be any opening to go all the way through. And that's much what we think of with all the different measures that we have been encouraging and reinforcing since this first started. So of course, the recommended face coverings. Again, there was some dispute about whether this was effective, but we do know that if both people who are in close proximity of each other are wearing their face masks, that's going to prevent the spread from me to you by using that face mask. And then if the other person is also wearing that, prevents the spread even further. So your percentage of blocking that transmission of that virus are much greater if both people have on face masks. Also, maintaining that good hygiene we've talked about, the hand washing, using hand sanitizer if hand washing facilities are not available. And then For businesses, they're asking that they continue to conduct the daily assessments of their employees as they come to work. I know there's been a lot of problems with temperatures because many people do not own their own thermometers, and I just heard yesterday someone trying to order another one, and it's going to be mid-June before they get it. So some people were lucky enough to get thermometers when they ordered them several months ago, but they keep running out of them different places. But you can always ask your employees, how are you feeling today? Do you have any symptoms that are of concern? And if somebody should have a concern, then they should be sent home. So the other thing is that physical distancing, and I can't stress that enough. Keeping that minimum of 6 feet distance along with the other measures you're taking are going to be effective in helping to prevent the spread of COVID-19. And of course, cleaning and sanitizing common areas is a very important thing to do as well. As I said, if you want to know more details about industry-specific guidelines or required criteria, then you can visit that website that I mentioned earlier. Also, one thing they mentioned Monday is there is a new set of symptoms that they are advising people that they want to watch for. Of course, if you remember right at first, our main criteria were elevated temperature, cough, and difficulty breathing. But now they've added a few more things. They've found as this outbreak continues, people are experiencing some different symptoms. Sometimes people do not have a fever right at first and often develop that later in the course of the illness. But people may have chills and shivering even if they don't have a fever. That seems to be a symptom now too. Muscle pain, those general body aches that you get, sore throat, headache, and loss of taste and smell if that's something new that you've not experienced before. So keep in mind those different symptoms that could occur if you do get an infection. The one phase that is not opening up yet includes restaurants, barbershops, salons, and spas, and they are looking at when those areas will be open, and I know that was disappointing for many people. The governor worked with other members of the Senate and the House to discuss this and to help identify people who work in those fields, and they will ask their members to come up with different individuals to serve on an advisory group as they start to plan how they are going to proceed past opening the retail stores. Also, you may have heard the governor mention, as he was asked by a reporter, what about high school graduations? And I know I've been working with a group of superintendents from the area up here talking about how they should hold graduation ceremonies, not the traditional ceremony, of course. And at first it was thought that virtually would be the only way they would allow that to happen, but as the governor said, he felt confidence that if a school could plan something where they are restricting people gathering together, just one student at a time receiving their diploma, people not getting out and gathering together, that the school could decide to do that. So we'll be seeing, I'm sure, in the very next week, these plans are going to need to be made as those graduation dates are coming up. So I'm sure you'll be hearing from your school if you have a graduating senior, and I'd say congratulations to them. And I do feel badly that this has really changed the way most students celebrate their senior year, and it's very unfortunate, but above all things, we want to keep people well. We want to protect you and keep you safe and keep you healthy, and that's the most important thing. Also within healthcare, many people have foregone those well child visits or those routine checkups. That is going to be something that the healthcare providers are going to be able to do now. Immunizations. In fact, here at the health department, last week we started on Thursday. Now we do Tuesdays and Thursdays here by appointment only. We will do immunizations as we have some very young children that need to get started on those and people that need to catch up on their immunizations. And of course, that's important. We feel strongly to maintain good health. So if you do have a child that needs an immunization, give us a call, 419-447-3691, and we'll get you directed to where you can make an appointment. And again, assuring that you are protected and kept safe during that. And they will instruct you what guidelines you need to utilize if you do come into the health department for immunizations. Also, something we talked about a few weeks ago was mental health and how this has been a real strain and very stressful for many people. And Dr. Acton mentioned that it's, and I did too, that it's nothing to feel ashamed of. If you need someone to talk to, probably I'd say almost all of us at some time could use someone to talk to when we're working through things like this. So again, I want to remind everyone to keep that distance, to use the face coverings, even though it's not mandated by the governor. I think it's the wisest thing to do, so I'd like you to keep that in mind. Usually I try to stick to just facts and information during this, but I found something on Facebook, so sometimes I do find things on Facebook that mean a lot to me and I think are worth hearing. And this I heard saw several weeks ago, and I want to share it with you. When this is over, may we never again take for granted the handshake of a stranger. Full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, the taste of communion, a routine checkup, the school rush each morning, or coffee with a friend, the stadium roaring, each deep breath that we take, a boring Tuesday, and just not take for granted life itself. And when this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hope to be, and may we stay that way, better for each other because of the worst. And we will come through this. This is one of the worst things I know many of us have experienced, but just hang in there. We're going to get you through it, and we're going to keep Seneca County healthy. Thank you again for joining me.